If you're over 50 and you take medication every day, there's something about your pills you may never have been told. Some commonly used medications can affect memory and thinking, and research has linked certain types, especially with long-term or cumulative use, to a higher risk of dementia. And here's what makes this especially important. You may be taking one of them for a completely different health problem. So which medications are we talking about? Number 3. Benzodiazepines. You may recognize names like Xanax, Ativan, or Valium. These medications are commonly prescribed for anxiety, panic attacks, and sometimes sleep problems. They work by slowing activity in the central nervous system, helping the brain and body relax. But they can also affect the way your brain works. Benzodiazepines can cause drowsiness, confusion, slower thinking, and problems with memory. And for older adults, those effects can be particularly important. Some research has also found an association between long-term benzodiazepine use and a higher risk of dementia. But there's an important catch. The research on benzodiazepines and dementia is still conflicting. Anxiety, agitation, and sleep problems can sometimes appear during the early stages of dementia, and those are also conditions for which benzodiazepines may be prescribed. So researchers can't always tell whether the medication contributed to the dementia risk or whether early symptoms led to the medication being prescribed in the first place. Either way, long-term use deserves a closer look. If you've been taking a benzodiazepine regularly, talk with your doctor or pharmacist about whether it's still the right medication for you, and never stop taking it suddenly on your own. Because the next one is another medication millions of people take for a very different reason: getting a good night's sleep. Number 2. Certain prescription sleep medications. One of the best-known examples is Zolpidem, sold under the brand name Ambien. These medications are designed to help you fall asleep, but researchers have also investigated whether regular or long-term use of Zolpidem is associated with dementia risk. Some studies have found an association, particularly among people with greater exposure to the medication. But that does not prove that Ambien causes dementia. The research is still mixed, and scientists have not established a simple cause and effect relationship. What makes this worth paying attention to is that sleep medications act on the brain, and older adults can be more sensitive to their effects. So if you regularly take Ambien or another prescription sleep medication, don't stop taking it on your own. Talk with your doctor or pharmacist about whether you still need it, whether the dose is appropriate, and whether there are other options worth discussing. And there's one more medication we need to talk about before the final reveal: corticosteroids. You may recognize names like prednisone, cortisone, or hydrocortisone. These medications are widely used to reduce inflammation and treat conditions ranging from allergies and asthma to autoimmune diseases. But corticosteroids can also affect the brain. In some people, they can cause confusion, mood changes, sleep problems, and memory changes. And here's what's particularly interesting. Some medication-related cognitive problems caused by corticosteroids can be reversible. In other words, cognitive symptoms caused by a medication don't automatically mean someone has permanent dementia. If you've noticed new confusion or memory changes after starting or increasing a corticosteroid, talk to your doctor. Don't stop the medication on your own. Now, number 1 is different. It's not just one medication. It's an entire category, and some of the medications in it are sitting in medicine cabinets all over the country. But protecting your health after 50 isn't only about knowing what to avoid. It's also about knowing what to put on your plate. That's why we created Make Every Bite Count, a practical guide designed to help you make smarter food choices for healthy aging. It brings together simple, practical nutrition guidance to help you make every meal count. If you'd like to take a look, you'll find the link in the description. And now I want to hear from you. Have you ever checked the side effects of the medications you take every day? Or did you simply trust that they were safe because they were prescribed to you? Tell me in the comments. But don't leave yet. There's one more medication category you need to know about. And unlike the medications we've covered so far, some of these can be found right on the pharmacy shelf. Number 1, anticholinergic medications. And this is where things get really interesting. Anticholinergic isn't the name of one medication. It's a whole category of drugs that can be used for very different health problems. Some are used for allergies. Others are prescribed for overactive bladder, nausea, depression, Parkinson's disease, and other conditions. What they have in common is the way they affect a chemical messenger called acetylcholine. Acetylcholine plays an important role in memory, learning, attention, and other brain functions. Anticholinergic medications block the action of acetylcholine, and in older adults, this can sometimes contribute to confusion, drowsiness, and memory problems. But there's an even bigger reason researchers have been paying attention to these medications. A large 2019 study looked at the medical records of almost 300,000 people aged 55 and older and found that greater cumulative exposure to strong anticholinergic medications was associated with a higher risk of developing dementia. In people with the highest exposure, the association was about 50% higher compared with those who had no anticholinergic exposure. But remember, this was an observational study. It found an association. It did not prove that these medications directly cause dementia, and that's an important distinction. Some of these medications can be completely appropriate and necessary for certain people. The question isn't whether you should suddenly stop taking them. The question is whether every medication you're taking is still necessary, especially if you've noticed changes in your memory or thinking. So take a moment to look at your medication list, including over-the-counter medicines. And if you recognize something we've discussed, don't stop taking it on your own. Talk to your doctor or pharmacist and ask whether it could be affecting your memory and whether there are alternatives that make sense for you. So what should you take away from all of this? These medications don't mean that you're going to develop dementia, and they certainly don't mean you should stop taking your prescriptions. What they do mean is that your medication list deserves a review, especially as you get older. If you're experiencing new memory problems, confusion, unusual drowsiness, or changes in the way you're thinking, tell your doctor or pharmacist about everything you're taking, including over-the-counter medicines. Sometimes a medication can contribute to cognitive symptoms, and your healthcare professional can determine whether a different medication, dose, or treatment approach makes sense for you. Never stop a prescription medication suddenly without medical guidance. Your medications are there to help you. The goal isn't to be afraid of them. The goal is to make sure you're taking the right medications at the right doses for the right reasons. Have you ever had a medication change after noticing memory problems? Tell me what happened in the comments. Your experience could help someone else ask the right question. But medications aren't the only piece of the memory puzzle. What you put on your plate matters too. In the next video, we're looking at 3 foods that can help support your brain and memory after 50. So if protecting your memory is important to you, don't miss that one. This video is for educational and informational purposes only and is not medical advice. Never stop, reduce, or change a prescription medication without first speaking with your doctor or pharmacist. If you're concerned about memory changes or the medications you're taking, discuss them with a qualified healthcare professional.